You're about to hear the details of a program that reduces a company's FICA tax liability by $600 per employee per year, while simultaneously giving the employees a raise to the tune of $90 to $300 per month in net take-home pay. This is made possible by a combination of some alterations in long-standing cafeteria plan tax codes, as well as recently implemented plans that most companies still don't know about. This is an opportunity for any company that has W-2 employees. The main purpose of this video is to establish authenticity and legitimacy around the PCMP. Your initial reaction when hearing about this might be skepticism. Too good to be true. I suggest you put those thoughts aside for the next few minutes. The fact is, this isn't a hypothetical. It's a reality. Today, and if you aren't familiar with PCMP, Preventative Care Management Programs, you and every company in the country will be within the next few months. Here's why. The Preventive Care Management Program, or PCMP, isn't some theory or loophole. As I said, it's built on established IRS tax provisions that have been on the books for years, in conjunction with more recently introduced laws around medical expense reimbursements. It's ACA compliant, and it's already working for thousands of companies, adding significant dollars to the bottom lines of both employers and employees. Here's the Cliff Notes explanation. I mentioned it at the beginning of this video, but it's worth repeating. For employers, they save an average of $600 per employee per year. That's net savings after all program costs. At 200 employees as an example, that's $120,000 a year going back into your business instead of to FICA tax. For employees, they get access to a comprehensive suite of wellness benefits with zero co-pays, zero out-of-pocket costs. And on top of that, they see an average increase of about $100 per month in their take-home pay. That's $1,200 a year, without you spending a dime. Here's a quick walkthrough on exactly how it works. The benefits, relationship to existing health plans, eligibility, who does what, and of course, the money trail. Let's look at the details of what an employee gets in this program. This isn't a bare bones program designed only to reduce tax overhead. These are real benefits from established providers intended to elevate an employee's physical and emotional health. You can see the full lineup on screen. Unlimited telehealth through UCM Digital Health, 24/7, 365, no co-pays ever. An employee assistance program through CorpCare, 6 sessions per family member at zero cost. Health Vitals through Anura's facial scan app, couples counseling, addiction recovery, and a full suite of Mayo Clinic wellness programs. 2 things I want to highlight. If your company already has an EAP in place, this doesn't replace it. It adds 6 more sessions on top. More benefits, not less. And all of these benefits extend to the employee's immediate family, with no change to any existing coverage. Forget the fact that there's no cost to the employee. They're actually being paid to use them. The eligibility requirements are straightforward. 3 criteria. The employee must be W-2. They need qualified health insurance from your company, a spouse, a parent, or an ACA exchange plan. The only exclusion is Medicaid, and they must earn at least $2,000 per month in gross income. That's it. In most companies, the vast majority of the workforce qualifies. We'll know the exact numbers once we run your payroll data. This is where people sometimes get nervous, so let me be clear. This program is built on well-established IRS tax provisions. It's documented, compliant, and CPA validated. It rests on 3 plan documents. A Section 125 cafeteria plan. You probably already have one. If not, that's fine. It's not a requirement for eligibility. A self-insured medical reimbursement plan, or SIMRP. This handles the non-taxable reimbursement at the bottom of the paycheck. And the Preventative Care Management Plan document itself, which validates that all benefits meet Section 213D criteria. I'm often asked, will this attract an audit? The fact is, when a company that has a PCMP has been audited, the PCMP has always passed through the audit and never been questioned. In no case was the PCMP the catalyst for the audit. We're happy to share all 3 documents with your attorney or CPA for review. This is where it all comes together. And this is the slide I really want you to pay attention to and probably revisit. It's a fair amount on the first pass. On the left, you've got a typical monthly paycheck. On the right, the same paycheck with the program in place. Look at the bottom in green. Notice the increase in the employee's take-home pay. Here's how it happens. We'll start at the top of the pay stub and work down. Same gross pay, $4,166. Same existing pre-tax deductions, $239.22. Nothing changes there. But now, on the right side, you see a new pre-tax deduction of $1,173. Now, and this is critical, that $1,173 is not the program fee. The actual program fee is $228 per month. The $1,173 represents the actuarial value of all the benefits your employee is receiving. If they went out on the open market and purchased each of these services individually, that's what it would cost. The reason the fee is only $228 is because the program has pre-established volume contracts with every one of these vendors. That spread, 1173 minus 228, is the engine that makes the whole thing work. So here's the math. That 1173 pre-tax deduction lowers the taxable pay from 3,927 down to 2,754. Lower taxable pay means lower payroll taxes for both the employer and the employee. For the employer, you're now paying 7.65% FICA on 1173 less in taxable wages. That generates roughly $90 in monthly savings. Your share of the program fee is $40. Net savings to you, $50 per employee per month. That's $600 per year per employee. At 200 employees, that's $120,000 a year. For the employee, the tax savings are even more dramatic. In this example, taxes drop from $928 to $651, a savings of $277. The employee's portion of the fee, $108 comes out of those savings automatically. They never feel it. And then, at the bottom of the paycheck, they receive an $1,173 reimbursement through the self-insured medical reimbursement plan, which offsets the deduction at the top. End result? Take-home pay goes from $2,998 to $3,088. The employee got a raise, a full suite of wellness benefits, and it didn't cost you, the employer, a penny. In fact, you saved the $50 I mentioned a few seconds ago. Think of it this way. It's like buying a $100 bill for $50. That's not a sales comment. That's simply the logic and reality of the math. Any business that can do that every single month for every single employee, that's a business we'd all like to participate in. This is what your employees see when they log in. The portal works on iPhone, Android, desktop, wherever they are. It's clean, it's intuitive, and it puts every benefit at their fingertips. They can access telehealth, check their health vitals through the facial scan, browse wellness content, track their progress, and connect to all of their active benefits from one dashboard. Now, I'll be straight with you. The portal is important, but it's not the main event. The main event is what shows up on their paycheck. Whether they use the portal daily or once a quarter, they're still getting the pay increase, and you're still getting the tax savings. The benefits are the cherry on top. The process is as straightforward as this. Step 1, you provide a payroll report, 10 minutes to pull. Step 2, within 48 hours, we come back with a customized savings proposal showing every eligible employee and the total company savings. This is not you signing up. It's a tool for you to see the numbers. Step 3, if you like what you see, you complete some simple documentation. Step 4, enrollment begins. We handle the heavy lifting. Communication templates, payroll code inputs, the full onboarding process. Step 5, the program goes live the first of the following month. Step 6, monthly invoicing, funded entirely by the savings you've already realized. You're net positive before you ever write that check. The total fee is $228 per employee per month. 40 from the employer, 188 from the employee. The employee's share is offset by their tax savings. Your $40 share is offset by the $90 in savings. Everybody comes out ahead. To build your customized savings proposal, we need one thing, a payroll census report. The data fields are standard, and your payroll system can generate it as a CSV or Excel export. If you're uneasy about sharing employee names, just use employee IDs. We'll turn it around within 48 hours into a detailed cost-benefit analysis by employee, summarized up to the corporate benefit. We suggest this step be taken as early in this process as possible. This document has proven to be invaluable as an assist when socializing this internally. Every month that passes without this program in place is money walking out the door, for you and for your employees. It's not money you can get back. No obligation, no cost, just the numbers. And then you decide, this is your money. You are effectively holding a check that you simply haven't cashed yet. Appreciate your time and your interest. Thank you.